嗨，大家好，我是蔡医师。几个月前呢，我试了一张很特别的人体工学椅。我第一次看到它的时候就觉得，它的设计好像很不一样。它没有扶手，也没有椅背，然后还会摇来摇去的。这怎么会有长这样子的人体工学椅？但是在试做了这几个月之后呢，我发现它真的有很厉害的地方。包括说它真的可以让你抬头挺胸。那你双脚着地，身体就会自然的挺直，抬头挺胸，所以就比较不会有弯腰驼背，那造成腰酸背痛的问题。那另外还听说它有一个很神奇的功能，就是说它可以帮坐在上面的人去燃烧卡路里。那躺着也可以变瘦，不是躺着啊，坐着也可以变瘦。这应该是大家梦寐以求的状况。所以到底是怎么做到的呢？今天我很开心的呢，邀请到这张椅子红岩爱脊椅 Red Rock 红岩爱脊椅的发明人 Dr. Osler， 他从美国跟我们视讯连线，来帮我们大家回答设计这张椅子的理念，以及这张椅子它有什么神奇的效果。Hi, Dr. Osler.
Dr. C, nice to meet you.
Hi, can you introduce yourself?
I'm Turner Osler. I'm an emeritus professor in the Department of Surgery at the University of Vermont here in the United States. I was a trauma surgeon for 20 years, and then I transitioned to doing epidemiology after I got a master's degree in biostatistics and a grant from the NIH to study how well trauma centers worked and how they might work better. I have really deep interest in epidemiology. It started out being just interested in the epidemiology of trauma, but when COVID came along, I got interested in that. We published a number of papers about COVID epidemiology. And then I got interested in the epidemiology of sitting. It seemed like a new field that nobody was working on, and I was excited to find out just how little we knew about sitting.
那我今天代表自己以及我们的观众来向 Dr. Osler 请教一些问题。那我们从第一题开始。第一题就是说，为什么有这么多人他会腰酸背痛？我们不管是在工作上班的人，还是说家庭主妇，为什么常常会腰酸背痛？常见的原因是什么呢？
Back pain is an incredibly common complaint. 80% of Americans at some point in their lives have back pain severe enough to send them to see a healthcare professional. When I was a young doctor in training, we would have young, healthy guys rolled into the emergency room who were just howling with pain. And, we'd take x-rays and we'd get scans and we'd think about it. And there was really nothing wrong with them except they were in incredible back pain. So we would give them pain medicine and send them home with the idea that almost always they would be better in a few days or a week. We didn't understand why people came in with this complaint, but because it never turned into something more serious, no one seemed to be very interested in what the mechanism behind it was. Now, we would always get scans and look at people carefully because rarely you can have a medical kind of emergency kind of back pain, spinal fracture or metastatic cancer to the spinal canal or spinal stenosis. There are a host of relatively rare conditions that can give you back pain. And so, these need to be, a patient needs to be looked at carefully to be sure you don't miss something that's catastrophic. But even 95% of low back pain is, as we say, idiopathic. We don't know what's causing it, which is an amazing admission for physicians that, one of the most common complaints of patients, and it's a severe problem, costs the United States $100 billion a year trying to make these patients feel better, and we don't really understand it. A whole issue of The Lancet, a very prestigious medical journal published a couple of years ago, was all about back pain, and the conclusion was we don't actually know what's causing it. My personal suspicion is that almost all of it is a matter of muscular spasm because it follows the time course of muscular spasm. It doesn't respond to really intense anti-inflammatories like steroids. Rather, it resolves over days or a week, and seemingly leaves without a trace. Except these patients are very prone to have recurrences of back pain. So it would be extremely helpful to figure out the solution so that patients don't walk around wondering when the next episode will occur.